Can you paint us a picture of what that looks like for a child who is, diagnosed with cancer in the US, for example, versus in Ghana? What are the options? What are the challenges that they go through? What are the likely survival rates and chances of getting treatment?
Right. It's I like that you brought this up because it's actually very it's important to paint the picture so that people like really understand why all of this makes sense. Like someone would say, well, it's childhood cancer. Everybody knows about childhood cancer, so they should be fine. You see pictures of bald children on websites and you see cure rates are high. Unfortunately, it's not the same for children in low and middle income countries. So we globally we expect about 400,000 children to have cancer before their 15th birthday. Unfortunately, the burden is quite high in low and middle income countries. So about 20% of those cases are diagnosed in high income countries, and 80% of those cases are diagnosed in low and middle income countries. However, when it comes to survivor, 80% of survivors occur in high income countries and as low as 20% in low and middle income countries, and in some countries as low as 10%. And so when a child is maybe has cancer in, say, in places like the US or the UK, there are systems that exist that they get the care as soon as possible. However, for a child in Ghana, for example, they sort of have symptoms of cancer very early on. They go to maybe a pharmacy. Let's say it presents with joint pain. They go to a pharmacy. They are given some paracetamol. They go back home. They go back to the pharmacy, given some antibiotics. They decide to go to the hospital. Let's say it's a very remote hospital where maybe the staff don't understand what childhood cancer is, or there's limited diagnostic capacity, and so they are treating for malaria that never goes away. The parents at that point may say, okay, I've tried the healthcare service and it didn't work, so maybe it's spiritual, right? I mean, we're African, so it has to be spiritual. They go back, they probably go to church, they probably go to a herbalist, they probably go to a traditionalist and try and get some treatment. It doesn't work. They sort of find their way back into the healthcare system. Unfortunately, by the time they arrive, it's quite late. It also means that advanced disease also means that you're using more treatment than you would use when they present in early stage. More treatment also means that they are going to be suppressed. Their immune system is going to be suppressed. That means that there's more infections. That means there's more money that you have to spend on antibiotics. That also means that they might die from toxic deaths rather than the cancer itself. So it's an interesting picture that we paint here, right? In a high income country, a child is seen, you suspect, you can do a CT scan, you can do a bone marrow, you can do all of these in a space of one day. However, over here, because most of these things have to be paid out of pocket, even when you suspect, you tell the parent or caregiver there has to be some fundraising that has to be done before you even get a diagnosis. And in some settings, even getting a histological diagnosis to confirm it's very difficult. So these are the realities that we face. The other thing is the treatment centers might be very, very far from where the patient lives. So even though they receive their treatment, they have to travel maybe 5 hours, maybe 9 hours back to where they live. If they have to do that journey all the time, and to the parents, it doesn't make sense. Once they see that the child is looking better, they assume that it's fine, and then they abandon treatment. This means that the disease is going to recur, and this means that we're going to lose that child at a certain point in time. So it's I don't know. It's a non-ending cycle. It continues from the point of diagnosis to the point of treatment, and even during treatment, retaining them sometimes is very difficult.